Hi there. I wanted to talk to you about some strategies that you can use to help with numbness and tingling you may be experiencing in your hands during and after pregnancy. Now, we know that during pregnancy, the most common reason for numbness and tingling in the hands is due to the increase in fluid retention, which is due to the hormonal changes that happen during pregnancy. Now, after pregnancy, those hormonal changes will continue, and sometimes that fluid retention will also continue. But we also have to bring in postural challenges that happen after pregnancy and while we are dealing with baby and possibly other children as well. Now, when we have our babies, we have a tendency to always hold them down. It's just the way it is. This is how we are designed to hold our babies. Even if we are wearing them and they are on our front, everything is still down. We never really hold our babies up here unless we're looking at them, and it's not for a long period of time, right? So we hold our babies and they are down. And sometimes if we are breastfeeding, they are down a little bit farther. And what happens when we have infants and newborns specifically is when they are breastfeeding or feeding, we check on them, make sure they're breathing, make sure they're positioned right, make sure they're latching okay. So we spend a lot of time looking down. When we have smaller children, we still spend a lot of time looking down. And a lot of our time with newborns is spent sitting down, looking down, doing a lot of things in this somewhat hunched position. It's just the way it is. There's not much that we can change about that other than, making conscious efforts to straighten up every so often during the day. But the fact is, we're tired. And being comfortable is more important to us than making sure that we maintain good posture at all times. Plus, posture should not be something that we are actively doing all day. It should be something that our bodies know how to do on their own. With babies, because they have now changed our postural demands, we are adapting to those postural demands as they are, as we are having them. So, what happens when we're doing this is that we're looking down. We have a tendency to completely round forward in some respects and round forward through the neck while looking down. We're doing this for long periods of time, long stretches of time. It's not like you're looking down to do one thing and then you sit back up and you're good. Sometimes, depending on your child, if your child is like mine, you can be breastfeeding for up to 45 minutes at a time every 2 hours. Babies don't have any rhyme or reason to why or when they are hungry or how long they're going to feed for, so you just deal with what you deal with. So, sitting in this position, we're putting a little bit extra strain on our arms as well, and then through our neck. And right through here, through this area of the neck between C5, cervical vertebrae 5, C6, C7, which is the big one that we can all feel, and this space we call C8, T1, which is the first thoracic vertebrae, that's where our ribs start coming in, is where all of the nerves that supply our arms come down. So when we are in this position, they are being put on a stretch, they are being compressed, they are being irritated. One of the best things to do that is easy and something that you can do while holding your baby or not holding your baby while you are alone, like that happens in our lives, right? Who's ever alone when they have babies? While you just have a moment where you're not holding your baby or holding your baby, it doesn't matter. You want to sit up kind of nice and tall as much as you can to make sure that your spine's a little bit more in more of a neutral position than slouching over. Sit up nice and tall, and we're going to do chin tucks. So what you're going to do is you're going to bring your chin back towards your neck. What you're also doing simultaneously is taking this base of your skull and bringing it up. So it's not just this, and it's not this. Not this. You are actively keeping your spine still while bringing your chin down and the back of your skull up. If you do this with your head on a wall or on the floor, you will have sensation to know that you are doing it properly because you will feel your head go up. Do that a couple times a day. Do it when you're feeling numbness and tingling through your hands. It will help significantly. Well, let's face it, not everything helps significantly for every person. Another thing you can do is nerve flossing, and I will send you a separate video, YouTube video, that will help you with some exercises for nerve flossing.